So anyone who presents with fever, pharyngitis, and lymphadenopathy with splenomegaly, then we would consider them to be having infectious mononucleosis. Yeah, if there's splenomegaly, hepatomegaly, you advise to avoid contact sports. It's a viral infection, so you don't give antibiotics. Just support to management with paracetamol, fluids, and any local anesthetic numbing agents for the back of the throat. Fever for more than 5 days, even without the other symptoms, the first thing that comes to your mind should be Kawasaki disease, and you should start examining the kid for the mucocutaneous features. Yeah. So high fever for more than 5 days and not responding to paracetamol is highly significant for Kawasaki.
Strawberry tongue is the easy way to remember
Mhm.
this. So
Mhm.
basically, the patient will have a red erythematic tongue, and
Yeah.
second thing, they can have a cracking of the lips. Uh,
And
they'll also develop a maculopapular rash on the body, is
Yeah.
the other thing, and
Mhm.
conjunctivitis.
Conjunctivitis. These are all mucocutaneous structures, right? The skin
Yeah.
and the mucous membrane. So look for the eye, conjunctivitis, uh, and in the oral cavity, the lips, cracking of the lip, the redness in the skin. So AMC asks questions on an intern level. They don't ask you at a specialist level. You don't have to think at the level of a cardiologist or a pediatrician or any immunologist or anyone. You need to think at the level of an intern, like as a primary care physician, as a GP. You see the patient, you pick out the feature, you present. If it's a GP, you refer this patient to a hospital, and if in the hospital, if you are a resident or an intern, you what do? You do some blood test based on all the features, the clinical features based on the blood investigation. You think it could be a Kawasaki disease, and then you get the advice of the pediatrician and start him on the aspirin immunoglobulin and refer to pediatrician. That's all you need to know. Okay, so here the answer would be vasculitis leading to coronary aneurysm is a leading complication. Yeah, they do have hepatomegaly. And option three, it has a fatality rate of point some percent. And usually AMC doesn't ask questions which involves numbers. You don't have to know statistics or any drug dosages and stuff at the top of your mind. But basic things like blood sugar level, what is the normal fasting blood sugar level? What is the normal sodium level, potassium level, calcium level? These are the things that you need to know. No need to remember all the statistic stuff. Okay. And for there are certain screening guidelines, like when do you scan for colon cancer? How often do you scan? Those kind of numbers are necessary.